Dr. Reed Tuckson is the co-founder of the Black Coalition Against COVID. He is joining us now to give us some more perspective on the rise in cases as we get closer to Christmas. Thank you so much for joining us, as always, here on BNC. So the CDC is saying that most people in the U.S. with Omicron were vaccinated. Is there talk of revamping these vaccines to make them more effective against Omicron and other potential new variants?
Thank you. There is no question that scientists are working feverishly to try to understand this Omicron variant and be able to provide, as necessary, new forms of the vaccine. But what we do know from the Oxford studies and others is that while there is a concerning fall off in the effectiveness of our existing vaccines, that adding a booster to it is very important. And so, what the focus now needs to be, in addition to wearing our masks and being very, very vigilant about not spreading this virus, is that those people who have gotten their doses already, their two doses of either Pfizer or Moderna or the one jab from J&J, you need now to get very quickly involved in getting the booster, because that's really what we're seeing now is effective.
It's hard to believe that this month actually marks a year since COVID-19 vaccines were implemented. Where are we now when it comes to getting the shot into the arms of every American?
We are we have a lot to be proud of, but unfortunately, we have not gone far enough. We now know that that probably, particularly in our senior population, and by the way, the numbers that just came out today are frightening. One in every 100 seniors in the United States has now died of COVID-19, and that's before we get to Omicron. And we now know that we've passed the 800,000 mark, which is also particularly frightening. But unfortunately, in our nursing home population, only about a half of them have gotten their vaccine, their booster. And that is very, very, very concerning. And we need to be able to get at that right away. Probably in around the country overall, we're somewhere in the 60% range. We need to be more in the 85, 90% range.
So does that mean people should be nervous about traveling? Because, Christmas is coming up and people want to visit relatives. Should they be concerned about traveling? And if they do, what precautions do they need to take?
Nervous is probably not a word. I would say it is vigilant, attentive, intelligent, responsible, mature. Those are good words to use. And what I would say in terms of what does that mean? It means, number one, get yourself vaccinated. And if you have had your second doses, or you're eligible from the first dose, time period has gone by, get your booster. That is the number one thing you must do. Number two, you've got to wear your mask anywhere you are now, indoors with other people who you do not know. And unless you're in your own home with people in your home who you know are vaccinated, you've got now to be wearing your mask. And as you travel, make sure that as you go on your way to the airport, in the airport, after you leave the airport, always make sure that you are masked. Those are the responsible things to do. Of course, do not travel if you are already feeling ill or unwell. That would be unwise, not only for you, but those around you. Other countries are putting in their own bans. And so you will find that you'll need to be very vigilant in searching which countries will allow you to travel there. And in particular, in the United States, there are certain states that will not let you travel there unless you have, in fact, be able to prove that you are vaccinated. This is going to be the order of the day.
Yeah, certainly we would hope that people would be responsible, but things happen. And there's little to no COVID-19 restrictions across the United States. Does that mean that after the holidays, we should expect a significant rise in hospitalizations and maybe even deaths after the holidays?
We knew that that was going to happen at Christmas time, and we predicted it on this very show on BNC, on this channel. And of course, unfortunately and tragically, it did come to pass. And so it is inevitable that there will be people who are hard-headed, ill-informed, misinformed, or just simply selfish, who will not follow our advice. And so you can expect a large increase. What we don't know, and the variable is whether or not the increases that we will experience will be like in the UK. In the UK now, the Omicron variant is spreading every other day, doubling in size. That could mean that there will be a lot more people who are infected in this country. What we don't know is how serious the consequences of that infection will be and whether it will lead to more hospitalizations and more deaths. That is still to be determined. But if you just do the math on the number of people now as who are being infected all through South Africa, through now Denmark, through the United Kingdom. If you do the math, there's a lot of people that are going to get sick. And of those who get sick, many of them will have a hard time overcoming the sickness, whether or not the Omicron variant proves to be as lethal as the Delta variant. It's simply a matter of how we do the math and how many people we're putting in harm's way.
Yeah, doctor, I'm actually glad that you brought up what happened in the United Kingdom because they have confirmed their first death. And that certainly is concerning for the rest of the world in terms of what the data will look like moving forward. But thank you so much. As always, we appreciate you having all of your insights, bringing your insights to us here on BNC. Take care.